oncology care warriors. Ever cared for a patient with persistent bone pain, unexplained anemia, or kidney issues, and only to discover a deeper diagnosis? You may be looking at multiple myeloma, a complex blood cancer that starts in the bone marrow and often hides behind vague symptoms. Today we're breaking down what multiple myeloma is, how it presents, how it's treated, and what nurses can do to support patients through this life-altering diagnosis. Multiple myeloma is a malignancy of plasma cells, the white blood cells that produce antibodies. In myeloma, abnormal plasma cells multiply uncontrollably in the bone marrow, crowding out healthy cells and producing defective immunoglobulins called M proteins. These abnormal cells cause widespread damage, especially to bones, kidneys, red blood cells, and immune function. Use the acronym CRAB to remember key signs and complications. C. Calcium elevation. Hypercalcemia from bone breakdown causes confusion, constipation, weakness. R. Renal insufficiency. Light chain proteins clog kidneys, causes elevated BUN creatinine, decreased GFR. A. Anemia. Bone marrow suppression causes fatigue, pallor, SOB. B. Bone lesions. Lytic lesions and fractures, especially spine, ribs, hips, causes severe pain. Other symptoms may include frequent infections, weight loss, and neuropathy from spinal cord compression. CBC, anemia, serum protein electrophoresis, SPEP, detects M protein, urine Bence-Jones protein, bone marrow biopsy, confirms abnormal plasma cells. Imaging, skeletal survey, MRI, PET scan for bone lesions, chemotherapy and targeted therapy, proteasome inhibitors, for example, bortezomib, immunomodulators, for example, lenalidomide, steroids, for example, dexamethasone, stem cell transplantation. Autologous transplant is common after remission induction. Supportive meds, bisphosphonates, for example zoledronic acid, to prevent bone breakdown. Erythropoietin-stimulating agents for anemia, antivirals or prophylactic antibiotics due to immune suppression. Manage pain and prevent fractures. Use scheduled analgesics, heat packs. Encourage gentle mobility, avoid high-impact activities. Coordinate physical therapy to maintain function safely. Monitor renal function. Track Wanyan-O's daily weights. Avoid nephrotoxic drugs. Maintain hydration unless contraindicated. Infection prevention. Monitor WBC and neutrophil count. Educate on hand hygiene. Avoid crowds. Prophylactic antivirals and vaccines as prescribed. Patient education and emotional support. Discuss treatment timeline, side effects, and lab monitoring. Provide resources for fatigue, nutrition, coping. Encourage involvement in support groups or counseling. Multiple myeloma isn't just a blood cancer. It's a systemic condition that requires whole-person care. As nurses, we're there every step, from diagnosis to daily support. Have you cared for a patient with myeloma? Share your best comfort strategies in the comments, like subscribe and follow for more oncology nursing insights, because knowledge leads to compassion.